welcome to another great Wellness Wednesday. This year alone, over 200,000 people have been diagnosed with lung cancer, and over 100,000 people have died from it. And it's shown that early prevention is the key to fighting this deadly disease. And joining us today is family medicine Dr. Bonnie Basler to speak about the importance of getting screened for lung cancer. How are you, Dr. Basler?
I'm well, thank you. Thank you for having me.
And thank you for being here with us. So what should people know, particularly when it comes to lung cancer?
Yes, we have a wonderful way now to screen for lung cancer. Many people are familiar with mammograms for breast cancer. You can think of this in the same way. It's an annual screening. People who don't have any symptoms but they're at high risk for lung cancer, we can screen and diagnose early and potentially cure many of those cases of lung cancer.
And when it comes to those who are at high risk, what are we talking about? Are we talking about smokers?
Yes, primarily if you've been a smoker, if you have we call it a 20-pack year history of smoking, which would be 1 pack a day for 20 years, half pack a day for 40 years, 2 packs a day for 10 years. Any combination of that would get you into that high risk category where you could qualify. Also 50 to 80 years of age. Medicare will cover it for ages 50 to 77. Most insurances will cover it, but if not, we have a special during the month of November, only $99 for the whole thing.
Okay, so tell us about the special. What does the screening consist of?
Yes, it's a low dose CT. It's actually a CT with a low dose of radiation. It's much better than previous. You know, you can't diagnose this early from a chest x-ray. That's not sensitive enough. But this is a CT scan. Only takes a few moments. There's no needles, no dye. If you're interested, just see your provider. And also you can look on our website, nmhs.net, to get more information and make sure you qualify.
Now, I am not a smoker, but I have been around a lot of smokers. When it comes to folks who are exposed to secondhand smoke, I mean, is the risk also high for us?
Yes, there is increased risk if you've been a passive smoker. And so, yes, speak to your provider and see if you might want to consider this test based on your exposure history. Great question.
Well, yeah.
Yeah.
I have been exposed a lot. You keep telling them stop and they keep just smoking.
Yes.
What is your goal for the month of November? Because this is Lung Cancer Awareness Month. What is your hope?
Yes, our hope is that we can screen as many people as possible. We have great resources here if we do detect the lung cancer to take care of that. So we really want to let as many people know as possible about this program and how important it is to get screened and hopefully get it cured.
Okay, and are there any symptoms that people need to look out for just to find out whether or not they could be a person with it?
Great question. If you're actually having symptoms, that's really different. Screening, we're looking for people who are at risk but who haven't developed any symptoms. But great question, because if you do have symptoms, maybe coughing up blood, a chronic cough, shortness of breath or something, please see your doctor, and there may be a different test that you need to go ahead and get that taken care of. But we're looking for people who no symptoms at all but just at risk.
Okay, and of course this is going on through the month of November.
Right.
Again, if you want to just let our viewers know, $99.
Yes, that's a great deal for the CT scan, the interpretation, everything for $99. And again, your insurance may cover it, so you have no out-of-pocket cost. But maybe if you don't quite meet the criteria, or if your insurance doesn't cover it, $99 is the total cost during the month of November.
All right, thank you so much there, Dr. Basler, for joining us
Thank
this
you.
afternoon.